For all the latest updates, subscribe to News9.
India is leaving no stone unturned in developing a vaccine against COVID-19. Two homegrown vaccine candidates, Covaxin and Zydus Cadila, have almost completed phase 2 clinical trials. The ICMR has said an emergency authorization of vaccine can be done if the centre agrees. Top officials of ICMR and AIIMS met the Standing Committee of Home Affairs. The meeting was called by Congress Deputy Leader of Rajya Sabha, Anand Sharma. ICMR made a presentation on the COVID-19 situation in the country. AIIMS also made a presentation on how the top medical college is helping in the fight against COVID-19. ICMR Director General Balram Bhargava and AIIMS Director Dr. Randeep Guleria led the presentation. ICMR Director General informed a parliamentary panel that Covaxin and Zydus Cadila are in different stages of clinical trial. The COVID-19 vaccine candidates coordinated by Bharat Biotech and Cadila are nearing completion of phase 2 trials. Usually the final trial for a vaccine takes 6 to 9 months. However, if the government agrees, emergency authorization of a vaccine is possible.
Normally, the final trial takes about 6 to 9 months, but if the government decides, an emergency authorization could be considered. Phase 2 clinical trial of the two indigenously developed COVID-19 vaccine candidates have almost been completed, and emergency authorization of a vaccine could be considered if the centre decides so.
The parliamentary panel has lauded the efforts of ICMR and the medical fraternity for their role in the fight against COVID-19. The panel was informed that the Serum Institute of India vaccine developed by Oxford will enter phase 2B this week. 1,700 participants have been identified for clinical trials across 17 states. ICMR said post stage 3 of human trial, the central government can opt for an emergency authorization of a vaccine. According to ICMR, the Oxford vaccine will be the first to hit the Indian markets. The first shot of Oxford AstraZeneca vaccine candidate will likely be available for Indians by the end of 2020. Meanwhile, the National Expert Group on Vaccine Administration is also working towards vaccine development, procurement and distribution. The expert group discussed the financial resources required for procurement of the COVID-19 vaccine and various options of financing the same. The meeting discussed available options in terms of delivery platforms and associated infrastructure for rollout of COVID-19 vaccination. Further, strategy and follow-up action on all possible scenarios to ensure equitable and transparent delivery of the vaccine was deliberated upon. Meanwhile, the ICMR said the apex body will aim at conducting 1 million tests a day by the end of August.